You are what you eat. Well, it's true. The quality of the food we eat can dramatically affect our health. Our role as caregivers is to ensure our patients have access to good and healthy foods. Poor eating habits or not having access to good food can cause obesity, heart disease, diabetes, and more. And a diet without vitamins and minerals can make our patients get sicker, easier, and stay sicker longer. When you're in a patient's home, you should look for a few simple signs, like if they have access to good food and if they are eating those good foods. 1. Look in the refrigerator and cabinets. Do you see expired food? This could mean the patient is eating old or dangerous foods. Empty shelves? This could mean the patient doesn't have access to getting food from a store or friends. 2. Look at the neighborhood. Where does your patient buy food? Is there a grocery store nearby that sells fresh vegetables, fruits, and other foods that the patient enjoys eating? Does the patient drive? If the patient doesn't drive, they may not have reliable transportation to and from the grocery store. Does the patient have access to foods they enjoy? If they can't find foods they like, they may be less likely to eat in general. 3. Look at the patient. Does arthritis make it difficult to chop vegetables? This may mean the patient can no longer physically cook or prepare nutritious food. Does the patient have false teeth, partials, a bridge, or other dental work? If so, the patient may choose to eat only soft foods. If you notice or observe something about the patient's food intake that directly affects their health, it's time to report it. It's important to pay attention to all kinds of problems that food can cause. It may affect the physical, mental, or emotional state of the patient. A food problem that affects emotional health. George doesn't have enough food in his house consistently and is always a bit hungry. This can quickly lead to feelings of depression and anxiety. You may report, George is always hungry throughout the day, even though he is eating his meals. He just doesn't seem to have enough food in the house for him to eat adequate amounts. He says he is feeling sad and anxious about the lack of food. A food problem that affects physical health could be, George only eats when his daughter brings over his favorites. When the daughter goes out of town, George simply doesn't eat well. A problem that affects cognitive health. George eats a lot of sweets, even though he is diabetic. When his blood sugar is too high, he can get confused. You might notice that he has been eating extra sweets by finding candy wrappers on the living room coffee table or in the garbage. Or you might notice he is acutely or suddenly confused, which could mean he is hyperglycemic, which means that his blood sugar is too high. In conclusion, to notice a food issue, 1. Look in the refrigerator and cabinets for expired or unsafe food. 2. Look where your patient buys food. Do they have access to fresh vegetables and fruits? 3. Look at the patient. Can they prepare food and eat easily? When you notice a problem, report it. Call your agency or send a message through your agency's app.